Toronto Police, the Ontario Association of Chiefs of Police, and the Ontario College of Pharmacists are making an announcement about a reduction in pharmacy robberies in the city and across the province. Let's listen live.
About the alarming increase in pharmacy robberies across our city. In 2021, there was a total of 49 pharmacy robberies, which jumped to 123 in 2022. This trend was continuing in 2023 until pharmacies across the city began to implement time delay safes. To provide context, pharmacy robberies were very lucrative. Each pill obtained was sold for profit, and there was an obvious demand. The public safety concerns around these robberies are significant. Criminals were often using stolen vehicles to commit these crimes, which is thereby creating a victim of auto theft. They were violently attacking pharmacists, staff, and putting the safety of customers at risk. And of course, the drugs would end up on the street, contributing to the opioid epidemic that is resulting in overdose deaths and having a traumatic and devastating effect on our communities. Apart from undertaking investigations, the Hold Up Squad, in conjunction with the Community Partnership and Engagement Unit, began to consult with pharmacies to determine what their needs were and to conduct crime prevention through environmental design. We took part in town hall meetings and presentations for the pharmacies to establish a collaborative working group with external partner agencies, including the Ontario College of Pharmacies, the Ontario Pharmacists Association, in an effort to spread awareness and safety tips to reduce the incidence of robberies and victimization. This included recommending that pharmacies invest in good surveillance cameras, panic alarms, and of course, time delay safes, and making sure those safes stay locked at all times. Time delay safes have proven very effective at deterring robberies at pharmacies in other jurisdictions, such as Western Canada, where the number of instances have been drastically reduced. We anticipated that they would have the same impact in Toronto, and they have. In 2023, pharmacies in Toronto decreased by 23% compared to 2022. Year-to-date pharmacy robberies are down 82% compared to the same period in 2023. This success speaks to the impact of time-delayed safes, but also demonstrates the importance of collaboration among stakeholders to address issues that impact the safety and well-being of our communities. Whether it be pharmacy robberies, carjackings, auto theft, or retail robberies, working together with our residents and our law enforcement and industry partners, we can make it harder for criminals to victimize our communities and ultimately make a safer and more secure Toronto for everyone. Now I'd like to ask Peel Regional Police Deputy Chief Mark DePatt to say a few words. Thank you.
Thank you, Inspector, and good morning, everyone. Thank you for joining us today. As the co-chair of the Ontario Association of Chiefs of Police Community Safety and Crime Prevention Committee, I'm pleased to speak on behalf of my co-chair, Director Barry Horvin of Windsor Police Service, and the entire committee membership represented by police services across the province, some of which have joined us today. I'm pleased to join the Ontario College of Pharmacists and our partners in law enforcement to share the positive impact of an innovative approach to enhancing security and safety for Ontario pharmacies through the adoption of time-delayed safes. We are in an era where we are facing challenges with both an opioid crisis and pharmacy robberies. These have become prevalent issues for our communities, and we must find solutions to address them to ensure everyone's safety and well-being. Time-delayed safes are designed to open only after a predetermined delay, making immediate access to controlled substances more difficult. This feature significantly diminishes the appeal of pharmacies as targets for criminals looking for quick theft opportunities. Time-delayed safes enhance the safety and peace of mind of pharmacy staff and their customers. Pharmacy workers are on the front line, often facing the direct threat of violence in robbery situations, knowing that high-value medications are securely locked away and inaccessible to alleviate anxiety, allowing them to focus on providing care to their clients rather than the traumatic confrontations. For customers, pharmacies can continue to be safe environments where the community can access the health and well-being resources they need and depend on. We are also seeing positive trends, such as a decrease in robbery incidents in pharmacies equipped with these time-delayed safes. As police services, we are always looking for opportunities and strategies to improve public safety and decrease the likelihood of crime. And this is an excellent example of how this can be done. In Peel Region alone, we've observed a significant decrease in pharmacy robberies since the implementation of time-delayed safes. It's also a demonstration of the impact of when law enforcement, stakeholders, and the community work together to identify solutions to improve safety for everyone. By reducing the number of robberies and break-ins, we are protecting our healthcare providers and their patients and allowing police to allocate their resources to other pressing community safety priorities. Finally, and unfortunately, our police officers are on the front line of the opioid crisis. We've seen the devastating impact on families and communities across Ontario when lives are taken by overdose and drug abuse. Through enhancing the security of narcotics and other controlled substances, helps to better regulate the distribution of potentially addictive medications and restricting access to those who've been prescribed these types of medications by the appropriate healthcare providers, which can limit prescription drug abuse. I would like to thank the Ontario College of Pharmacists, all the pharmacists and their staff across this province for their vital role that they play in our community's well-being. And to our police professionals and partners, thank you for your role in making Ontario safe every day. And now, I would like to ask James Morrison, the chair of the Ontario College of Pharmacists, to say a few words.
Good morning. My name is James Morrison. I am the board chair of the Ontario College of Pharmacists. We are Canada's largest pharmacy regulator, overseeing Ontario's 25,000 pharmacists and pharmacy technicians and nearly 5,000 community pharmacies and hundreds of hospital pharmacies. We are here today to announce an important milestone in the prevention of pharmacy robberies. Every community pharmacy in Ontario, all 4,900 of them, in every corner of the province, is now reporting the use of time-delayed safes for the storage of narcotics. As a pharmacist, I know many who have experienced the trauma of a pharmacy robbery firsthand. They can cause emotional and physical harm to those who experience them and witness them, and cause societal harms as a result of stolen drugs making their way into local communities. Over the past few years, the college has been partnering with the Ontario Association of Chiefs of Police to help, and other law enforcement partners, on an array of activities to help pharmacies prevent robbery and thefts of narcotics and how to respond to them if they ever experience a robbery. During this work, we monitored the actions taken by other provinces that were also looking at ways to prevent robbery of narcotics from community pharmacies. One of those strategies increasingly adopted was the universal use of time-delayed safes in pharmacies and signage indicating their use. We know from our law enforcement partners and those who target pharmacies rely on speed to enter, to acquire stored narcotics, and exit quickly. By requiring narcotics to be stored in time-delayed safes that could only be opened after a minimum amount of time has elapsed, it denies perpetrators of the ability to get in and out of pharmacies quickly with stolen narcotics. It deters pharmacy robberies from happening in the first place. especially when all pharmacies are using time-delayed safes and when people know about their use. British Columbia and Alberta were the first two.
Okay, so we've been listening to an announcement. Get this number from Toronto Police. The number of pharmacy robberies pretty much tripled from 2021 to 2022, going from 49 to just over 140. But that has been curbed due to the use of time-delayed safes. Again, this is the announcement that we have been hearing from Toronto Police, the Ontario Association of Chiefs of Police, and the Ontario College of Pharmacists, again, make this announcement about their progress in curbing those robberies.